when we asked participants whether they had had pain in the last 12 months, then 20% said yes to that. So it's a big problem.
So a decent number of our listeners have got toothache.
Yeah. Rates of tooth decay have gone up back to almost 1998 levels. If we look at the most sensitive measure of tooth decay, then it was about 60%. If we look at people with actual holes in their teeth, that was about 20%. So
Really?
again, it's
1 in 5 people.
1 in 5 people.
Tell us about why tooth pain is so bad.
So tooth pain and sort of pain in the head and neck is bad in general because the teeth and the head and neck is extremely well innervated. So the trigeminal nerve, which supplies sensation to the head and neck and the teeth, is very good at picking up pain. Do you remember from med school the homunculus, the visual representation of different body parts and how much they contribute in terms of sensation?
We remember, but for our listeners, perhaps paint a picture.
So if you imagine a weirdly shaped human where each body part is magnified by how much sensation that body part gets. So, you'll end up with someone who has really big lips because the lips are very sensitive. The hands are really
Huge
big.
hands.
Exactly. So
very small back and chest.
Yeah, absolutely.
Okay.
So you have this sort of weirdly shaped human, but the shape is representing what sensory input that particular body part gives. 50% of that is the head and neck. So it's really well innervated.
So I love that, actually, that just half the sensation information that your brain receives
Head and neck.
is from the neck up. Your body, the whole rest of your body just isn't sending that much information back in comparison to your head and neck.
Yeah.
Wow. Okay. Praveen, walk us through the causes of toothache.
So the common causes of toothache are dentine hypersensitivity. So that's when you have sensitivity to hot or cold. This is typically a sudden sharp pain on a stimulus. So typically like cold drinks. If you go for a run and if you're getting that cold air, then you might feel it. If you're having a cold drink or a cold bit of ice cream, then you might feel it. And that could be on a spectrum, a healthy response to an extreme of temperature, which healthy teeth should have. So if you're kind of bit into ice cream, you should feel that cold. And that cold should be an uncomfortable sensation. And that may have been an evolutionary protective thing. So you don't do that again to your teeth. So that's dentine hypersensitivity. And that could range from, like I said, a healthy response to a more pathological response where you're getting that extreme response to temperature in temperatures that aren't that extreme. So room temperature water, you're not able to drink, that kind of thing. So that's dentine hypersensitivity. You could have tooth decay, which then leads to either an irritation of the pulp, which could be reversible. That can progress to irreversible pulpitis, which can then progress to an infection on the tip of the root called apical periodontitis. And the characteristic of these pains are very different. So in reversible pulpitis, you'll have this sort of poorly localized pain. So you can't really tell where the pain is coming from. And it could be as bad as, I know this on the left-hand side, but I have no idea whether it's a top tooth or a bottom
Oh, really?
tooth. Yeah.
I couldn't tell which tooth I had a problem with. And they had to go through this whole exercise of getting me to bite on these things. And I knew that one of them was going to make my head explode, but I didn't know which tooth it was going to be. So it was like it was a sort of Russian roulette. And eventually they found the tooth and I was, it's horrible.
It's great that they found the tooth because sometimes there's this diagnostic uncertainty and you're like, well, it could be this tooth, it could be this tooth. And I honestly don't know which is the right tooth that's causing this pain.
Put them all out.
Well, yeah, that's plan Z. Put it right at the bottom of the pile. But yeah, the next stage on is irreversible pulpitis. That's when the decay has progressed to such an extent and inflamed the pulp to such an extent that is irreversibly damaged now. So there's no coming back from that. And that is typically pain that is, again, poorly localized. Like reversible pulpitis, it's kind of made worse with hot food, cold food, but it can have a spontaneous onset as well. So you're just sat there watching TV and the pain comes on, and the pain typically lasts for a lot longer. So more than 5 minutes, more than half an hour. That's a signal that this is now getting into irreversible pulpitis territory. And the management of reversible pulpitis is more straightforward. So you can have the caries removed and a filling placed, and that removes the insult, and the pulp then recovers. With irreversible pulpitis, then the treatment is, if the tooth is savable, to initiate root canal therapy or to somehow protect the pulp if it can be protected.
I'll ask you a question. Decay. What's going on? What is tooth decay and what drives it?
So tooth decay, on a very, again, simplistic level, you need 4 things. You need a tooth to be decayed. You need bacteria in the mouth to do the decaying. You need a food substance for those bacteria to metabolize, and that can be sugars, carbohydrates, that can be then metabolized into sugars, which then produces the acid, which does the dissolving. And you need all of those three things to be present with time.
Okay. People say the sugar rots your teeth. That isn't quite true. It's the bugs in your mouth eat the sugar, and they then release acids, and the acids dissolve the enamel on your teeth.
Absolutely. It dissolves the enamel slowly because the enamel is really tough. Once it dissolves the enamel, it has an easier time dissolving the dentine because the dentine is softer. And then once it goes through the dentine layer, then it goes into the pulp. And once it's into the pulp and it damages the pulp irreversibly, then the only way to get rid of that infection that's contained now in the pulp, because one of the first things that bacteria do when they get into the pulp is they kill off the blood supply to the pulp. Obviously, inflammation leads to swelling, and that swelling constricts the blood vessels to a point where they can't supply the blood and they die off. Okay.
And then you haven't got antibodies, you haven't got your immune system.
There are no white blood cells going to it.
Not only that, but you also then don't get antibiotics going in there. So if you have a toothache, antibiotics are often not the solution to the problem.
Because the antibiotics go from your gut to your bloodstream, but if there's no blood going to the infection, they can't penetrate.
Treat the source of the infection. So then to treat the source of that infection, you have two options. Either you can remove the whole tooth, and as you remove the tooth, you remove the root canal, and as you remove the root canal, you remove those bacteria, or someone can go in and clean that root canal, right, and fill that root canal. So that's called a root canal filling, or a root filling, or a root canal treatment, or an RCT.
Root canal's a thing to dread?
I don't think so. So I do these. It's quite a boring process when you're having it done. And I'm not saying this to brag, but a lot of patients just fall asleep when they're having this done. You can relax during it, but also dentistry, one of the things I like about dentistry is this ability to kind of switch off pain. I can, with local anesthetic on its own, but also then the management of the reason for the cause of that pain, I can take that pain away.
How common is toothache?
Oh, so we had a recent survey. So every 10 years, the government does a survey of the state of the nation's teeth, the adult dental health survey and the child dental health survey. We had one that was done in 2021. And in that, when we asked participants whether they had had pain in the last 12 months, then 20% said yes to that. So it's a big problem. And in kids, in the 6-year-old survey, it was like 16% had pain in the last 3 months. So that was...
So a decent number of our listeners, the radio on right now, have got toothache.
Yeah. Or would have had toothache in the last year.
Or can certainly relate to this.
Yeah,
okay.
Absolutely. The other thing to mention about the state of the nation's teeth is tooth decay is a big problem, and some of the trends in tooth decay I think are going backwards. In the 2023 survey, the rates of tooth decay have gone up back to almost 1998 levels. So in the general population, if we look at the most sensitive measure of tooth decay, then it was about 60%. If we look at people with actual holes in their teeth that you can see, a physical hole in their teeth, that was about 20%. So again, it's
1 in 5 people.
1 in 5 people.
Why is it so common?
So tooth decay, as we spoke about in the etiology, is caused by a combination of a dip in oral hygiene, sugar in your diet. You can't get rid of the bacteria from your mouth. You can't sterilize the mouth, but maybe you can intervene on that with modifications in your diet. So say, for example, if you had a patient who was having 3 cans of cola a day, I could say to them, what can you do to reduce this? Can you take this down to none a day and only on the weekend or whatever? So that'll be the first thing to do, is cut it out completely. If they can't cut it out, then it'll do more damage if it's sort of nursed over a long time on its own, as opposed to had with a meal, because the acid
like
and the sugar...
having a big thing at your desk, just sipping all day so that the teeth are constantly bathed.
Exactly. And they're just not getting that chance to recover, because what happens is when you have the sugar insult, your pH in the mouth drops very suddenly, and then it takes 40 minutes to kind of recover.
Does the form of sugar make a difference? So in other words, if my kids have a spoonful of sugar on their porridge that they eat and then they're kind of done, I intuitively feel like if they were then to chew up the same quantity of sugar but in a little chewy sweet that would lodge between their teeth, I feel like that would be worse. Is that right?
That's worse for 2 reasons. One, if they're chewing it throughout the day, then even if it wasn't stuck to the teeth because it's chewy, it's still a longer exposure. Okay. But then the length of exposure is increased by the sweet itself being chewy. The same goes for snacks. So say, for example, if you like biscuits and you want to have a biscuit, that biscuit is going to do more damage if it's had between meals than if it's had with a meal or after a meal.
Right.
So the fact that you've eaten something means that your kind of saliva flow is increased already. You're washing away a lot of the food in drink already. You're reducing that exposure by that factor. So if you have a fizzy cola with a meal, it's going to do less damage than if you have it in the middle of the day, just on its own kind of thing.
So is this a problem where people need to step up and look after themselves more? Is this an issue where people aren't buying the toothpaste, the toothbrush, investing? The last time you were on the show, you talked about those kind of investing, the really thoughtful 2 minutes a day cleaning your teeth.
Yeah.
Or is this a wider kind of public health crisis?
I think it's both. It's very complex. The environment doesn't allow that change to be as easy as it may appear on paper. And we find this in the adult oral health survey as well, is that these problems in oral health are exacerbated by geography, by socioeconomic status, by household income and things like that. So there are other determinants to these. It's not as simple as, well, you're not looking after your teeth kind of thing. The system could be better where people can make those choices easier. Because in theory, again, it's for the vast majority of people, a completely preventable disease.
When we talk about it being preventable, are there genetic vulnerabilities that make it harder for some people, or can most people with lifestyle measures and behaviors actually prevent tooth decay and toothache?
Yeah, so there are some genetic conditions that'll make the enamel structurally different and more prone to decay. Those are rare. So the vast majority of people, tooth decay is, in theory, preventable.
Teeth grinding, I think a lot of people will have some experience with that, or listening to a partner doing it. Can you talk to us about teeth grinding?
Oh, so teeth grinding is something that we're still kind of unpacking a lot. It used to be thought as a problem in and of itself, but now it's thought of more as a behavior that can lead to problems. So teeth grinding or teeth clenching could be when you're awake, you're doing it. So you might be stuck in traffic and you're gritting your teeth. Most people, though, are not aware that they're doing it. Most people do it when they're sleeping. So that's called sleep bruxism. Bruxism is the sort of technical term for tooth grinding. So they have awake bruxism or sleep bruxism. And sleep bruxism is often picked up by dentists because they see the signs of it. And one of the signs of it may be you've got a loss of tooth substance that is not because of caries, not because of tooth decay. And your dentist may pick up on that. Or, like you said, your partner may be saying, oh, you were grinding your teeth when you were sleeping because I could hear it. The causes, again, are not that well understood, but we know what kind of makes it worse. There's a genetic component to tooth grinding, but things like stresses is going to make it worse. So you might find that you grind your teeth more when you're going through periods of stress. And that could be even temperature stress. So, on a cold night, you might grind your teeth more.
And are there simple treatments?
So if you're doing it while you're awake and if you can kind of talk yourself into not doing it. So the teeth are designed to only be in contact when you're chewing or swallowing. So when you're at rest, your teeth shouldn't be touching. So if you just sat there and if you go, yeah, my teeth are apart, that's great. If that then you're clenching your teeth, that shouldn't be happening. A lot of the time when we're asleep, we don't have that same level of control. So then one of the easiest things to do is, again, if you can go to your dentist and get a mouth guard made, a hard plastic guard made, that can help at least stop the damage on the teeth, but also maybe help with the causes of that bruxism.
What should people do if they've got toothache?
So again, if it depends on what kind of toothache you have. So the best advice is to actually go see your dentist because they may be able to tell you why you have this toothache and either prevent it if it's in a stage that it can be prevented, or treat it if it needs the treatment. So if you have toothache, then by and large, going to your dentist is a good idea, even if you have sensitivity. So if you have sensitivity, it's probably the most easy one to manage at home. And if you have that, then you can buy sort of sensitivity type toothpaste that work in different ways. Some of them work in sort of blocking the tubules that kind of make the dentine more porous. Some of them work in sort of desensitizing the nerves. So you can buy sensitivity toothpaste and you can use them almost like a cream. So you wash your hands at night, you get a little bit of sensitivity toothpaste on your finger and you rub it onto the tooth or the gum where you've got this sensitivity, where you've got this sharp pain. And that'll occlude the tubules or desensitize the nerves and it'll block that pain. What you're doing there is you're managing the symptom of the pain. So it's still a good idea to go to your dentist to find out why did the sensitivity come about in the first place, because it may be that it's a brushing technique, so you're just scrubbing the gums and that is causing the sensitivity. because it's exposing the dentine, or because your diet is acidic, so you're eroding the enamel away, so you're exposing more dentine. So as well as managing the symptom, you can also treat the cause of the pain. Other pains you cannot help generally at home by yourself. So if you've got this sort of pain that's made worse with hot and cold, if you've got this sort of poorly localized pain, when that happens, it's a really good idea to go to your dentist, because the earlier you can present, the more options you have, because you may get to a stage where the tooth is just so badly decayed that the only option left is to have it taken out.
But when you say go and see your dentist, I think we will have listeners going, I don't have a dentist.
Yeah.
It is reasonable to say that there are people in the UK
dental access
that
is
just
a problem.
cannot access a dentist.
It is.
And
Absolutely. So in a world where you can access your dentist, then going to your dentist is the thing to do.
I think for anyone who's had toothache, they know that it just takes over you can't do anything else when you've got it. And yet it feels sort of not that serious. Like it's not a sort of major public health problem that we talk about a lot. Do you think it should be taken more seriously?
So it is a major public health problem, but you're right, we don't talk about it enough. So I would say, yes, it should be taken more seriously, because one of the things that happens as a consequence of toothache, or can happen as a consequence of toothache, is tooth loss. And tooth loss now we know has a big effect.